So this will be the part 2 of the part 3 series of male reproductive physiology. So I will start with the capacitation of spermatozoa, which is required for the fertilization of ovum. So itong capacitation na to, ito yung parang transformation ng male spermatozoa natin para ma-fertilize si ovum. Okay? So multiple changes occur to activate the sperm for the final processes of fertilization. These collective changes are called capacitation of the spermatozoa, which normally requires from 1 to 10 hours. So ganun siya katagal, 1 to 10 hours para mag-transform yung mature spermatozoa para ma-fertilize niya yung ovum. Okay? So, sabi sa Guyton, the following changes are believed to occur. So, yung una, the uterine and the fallopian tube fluids wash away the various inhibitory factors that suppress the sperm activity in the male genital tracts. Kasi sa male genital tracts, meron tayong tinatawag na mga inhibitory factors in which in-inhibit niya yung pag-mature or pagiging magkaroon yung ability yung mature spermatozoa to fertilize the ovum. Parang ini-inhibit niya pa muna para hindi muna siya maging active, parang ganun. Okay? So yung pangalawa na nangyayari sa spermatozoa is while the spermatozoa remain in the fluid of the male genital ducts, they are continually exposed to many floating vesicles from the seminiferous tubules containing large amounts of cholesterol. So this cholesterol is continually added to the cellular membrane covering the sperm acrosome, toughening this membrane and preventing release of its enzyme. So during the stay ng spermatozoa sa male genital tracts, it gains large amounts of cholesterol. So yung cholesterol na yun nag-a-add sa integrity ng cellular membrane ng spermatozoa. Okay? So it toughens the membrane and preventing the release of its enzyme, di ba? Kung maalala nyo sa part 1 natin, yung sinasabi nila na yung acrosome, it contains different enzymes, di ba? Yung una dun is hyaluronidase saka proteolytic enzymes yung pangalawa. Okay? So after ejaculation, the sperm deposited in the vagina swim away from the cholesterol vesicles upward into the uterine cavity, and they gradually lose much of their excess cholesterol during the next few hours. In so doing, the membrane at the head of the sperm or the acrosome becomes much more weaker. So anong nangyayari dito, yung cholesterol na nagain nila during the stay nila sa male genital ducts is nababawasan, nawawala, kaya gradually loose. Okay, so ang tendency nun, kapag weak na yung cellular membrane dun sa acrosome, mas madali nang i-release nung head ng sperm yung mga proteolytic enzymes saka hyaluronidase, para yung mga enzymes na yun, it will digest the covering of the ovum, and eventually this will aid in the fertilization of the ovum. Okay? Next. So yung pangatlo nangyayari sa capacitation is the membranes of the sperm also becomes much more permeable to calcium ions. So calcium ions now enters the sperm in abundance and changes the activity of the flagellum, giving it a powerful whiplash motion in contrast to its previously weak undulating motion. So nangyayari dito sa pangatlong transformation ng spermatozoa natin is that nagiging permeable siya sa calcium. So yung calcium na to, it activates or it changes the activity of the flagellum. So nangyayari, mas nagiging motile yung sperm because of the increased permeability sa calcium. Okay? So also, in addition, the calcium ions causes changes in the intracellular cellular membrane that cover the leading edge of the acrosome, making it possible for the acrosome to release its enzyme rapidly and easily as the sperm penetrates a granulosa cell mass surrounding the ovum, and even more so as it attempts to penetrate the zona pellucida of the ovum. So isa rin sa transformation na nangyayari is that yung calcium ions natin mas nagiging permeable sa cellular membrane. Okay? So ang nangyayari doon, yung mga calcium na yun ginagamit nung cell para ma-release niya yung enzymes na nandun. So, ginagamit ng sperm cell yon, yung mga calcium na yon, para i-release easily yung enzymes. Okay? Kasi kailangan ng calcium para mag-fuse yung mga vesicles at para maging ma-release nung vesicle na yon yung ano niya, yung enzymes na hinahold niya. Diba kasi yung vesicle, may mga enzymes yon. So, kailangan ng calcium para ma-release yung enzymes na nandun sa loob ng vesicle. Okay? Yun. So, pag na-release na yung enzyme na yun, it will lead to the penetration of the granulosa cell mass surrounding the ovum and also the zona pellucida covering the ovum. Kasi itong granulosa cell mass sa zona pellucida, para siyang covering ng ovum. So, ang purpose ng acrosome or yung enzymes dun sa acrosome is para ma-penetrate nito yung mga covering ng ovum para yung mismong genetic material ng sperm is mapunta dito sa ovum or mag-meet sila with the ovum. Okay. So thus, these multiple changes occur during the process of capacitation. So without these changes, the sperm cannot make its way to the interior of the ovum to cause fertilization. So ito, kapag hindi nangyari ito, mababawasan yung percentage in which fertilization can occur. Okay? So next, acrosome enzymes in the acrosome reaction and the penetration of the ovum. Okay? So sinabi ko ito noon na stored in the acrosome of the sperm are large quantities of hyaluronidase and proteolytic enzymes. So the hyaluronidase depolymerizes the hyaluronic acid polymers in the intercellular cement that holds the ovarian granulosa cells. So the proteolytic enzymes digest proteins and the structural elements of tissue cells that still adhere to the ovum. So ito lang, sinasabi niya lang dito yung mechanism of action ng mga different enzymes na nasa acrosome. For example, hyaluronidase depolymerizes the hyaluronic acid polymers naman. Pag proteolytic enzymes, it digests proteins in the structural element of the tissue cell. Ganun. Okay. So, most common, laging tinatanong to, why does only one sperm enter the oocyte? So, sabi sa Guyton, the reason is not entirely known, but within a few minutes after the first sperm penetrates the zona pellucida of the ovum, calcium ions diffuse inward through the oocyte membrane and cause multiple cortical granules to be released by exocytosis from the oocyte into the perivitelline space. So these granules contain substances that permeate all portions of the zona pellucida and prevent binding of additional sperm, and they even cause any sperm that have already begun to bind to fall off. Thus, almost never does more than one sperm enter the oocyte during fertilization. So, anong nangyayari dito? Hindi rin nila alam kung ba't iisa lang ang nagpa-fertilize dun sa oocyte. So, kasi ang mechanism na nakita nila is that the calcium ions daw pumupunta inward through the oocyte. Ngayon, yung calcium na yon, it causes the exocytosis of the multiple cortical granules. Diba sinabi ko kanina na kailangan ng calcium para magkaroon ng exocytosis ng mga vesicles or ng mga tinatawag nating mga granules sa cell. Okay? So, yung cell na yun kasi, ay yung granules na yun, meron daw siyang substances na pinaprevent yung buong paligid ng zona pellucida at nung mismong oocyte na mag-bind sa ibang additional sperm. So, para siyang barrier. So, yung mga cortical granules na to, nagre-release siya ng substance na parang nagpe-prevent ng binding ng additional sperm. So, yun yung mechanism na nangyayari kapag fertilization na. Okay? So, kaya iisa lang ang nag-enter sa oocyte because of this mechanism. Okay? So, mga clinical correlations dito sa part ng major subdivision na ito. Okay? So, number 1 is bilateral orchitis. So, ito yung picture na to. So, nangyayari kasi sa bilateral orchitis or tinatawag na inflammation of the testes, it results from mumps. Okay? So, ito sa Tagalog, sinasabi nila ito yung beke. Okay? Sa bata, beke na tinatawag. Okay? So, this is the inflammation of usually the parotid glands. Okay? Pero may mga complications kasi in which nagkakaroon ng bilateral orchitis in which the testis is inflamed also because of the mumps virus. Okay? ang nangyayari dito, dahil sa inflammation, it can cause sterility dun sa affected male natin. Okay? So another is that some male infants are born with degenerate tubular epithelia as a result of strictures in the genital ducts or other abnormalities. So nangyayari dito, may problema dun sa conducting system nung bata, okay, or nung infant. So nangyayari, nagkakaroon ng parang stricture or parang nagtatali-tali yung mga conducting system nila. So 'di ba, pag nagtali-tali 'yon or nagkabuhol-buhol 'yon, may tendency na hindi maka-exit yung sperm dun sa mismong testis papunta sa external environment. Okay? So finally, meron din is another cause of sterility is usually temporary is excessive temperature of the testes. So, okay. So ito yung effect na temperature on spermatogenesis. So sabi nila, increasing the temperature of the testes can prevent spermatogenesis by causing the generation of most cells of the seminiferous tubules beside the spermatogonia. So, nangyayari daw, kakaroon ng degeneration ng cells sa mismong seminiferous tubules, diba? Kung maalala nyo, ang seminiferous tubules, dito na-form yung sperm. Okay? It has often been stated that the reason the testes are located in the dangling scrotum is to maintain the temperature of these glands below the internal temperature of the body, although usually only about 2 degrees Celsius below the internal temperature. So as you can see, diba, we all know that the testes is located outside the body, or it is dangling with this scrotum, diba? Nakalabas siya usually. So ang purpose daw nun is para maging 2 degrees Celsius cooler yung testes sa body temperature. So, take note nyo lang dito, sa Guyton kasi sinasabi niya na 2 degrees Celsius daw yung difference from the internal body temperature. Okay, so mas malamig yung temperature ng testis by 2 degrees Celsius. Okay. And then another clinical correlation is that Cryptorchidism. Okay, so Cryptorchidism means failure of a testis to descend from the abdomen into the scrotum at or near the time of birth of a fetus. So during development kasi of the male fetus, the testes are derived from the genital ridges in the abdomen. However, at about 3 weeks to 1 month before the birth of the baby, the testes normally descend through the inguinal canals into the scrotum. So ano ibig sabihin nito? Ang Cryptorchidism kasi, di ba sinabi niya, it means failure of the testes to descend. So ano nga ba? Ano bang cause kung bakit, ano bang dahilan kung bakit nagde-descend yung testis natin, di ba? Ang effect na nasa book is that testosterone daw stimulates the descent of the testis. So, anong nangyayari dito sa Cryptorchidism kasi, there is no enough testosterone that will stimulate the descent of the testis. Okay? So, ngayon, sa mga patient na to, they usually manifest abnormal location of the testes because of the not enough testosterone produced by the fetal testes. So, nagigets nyo ba? So, anong nangyayari? Walang enough na testosterone. So, pag walang testosterone, walang magandang descent yung testis natin. Ganon. Okay? Kasi normally daw, dapat 3 weeks to 1 month before the birth of the baby, the testes normally descend through the inguinal canal into the scrotum. So, anong nangyayari dito kasi is that walang enough stimulation by the testosterone due to many factors like may abnormal daw na testis which does not secrete enough testosterone for the descent of the testis itself. Okay? So, occasionally, this descent does not occur or occurs incompletely, and as a result, one or both testes remain in the abdomen, in the inguinal canal, or elsewhere along the route of descent. So, nakita ko itong picture na to sa internet, in which ito yung percentage of occurrence kung saan usually nakikita yung testis to a patient with Cryptorchidism. So, 15% abdominal, so nandyan usually, 25% inguinal canal, naka-stay dyan, or majority of the cases is high scrotal, so the testis is located up in the superior end of the scrotum. Okay, so ito also one of the important things to know about this part of the lecture is that is the effect of sperm count on fertility. So, some statistics lang. The semen ejaculated during each coitus averages about 3.5 ml. So, each ml daw contains an average of 120 million sperm. Although, even in normal males, this quantity can vary 35 million to 200 million. So, ito yung range niya. 35 to 200 million. Yung average kasi is 120 million per ml. Okay? Okay, so this means that an average of total of 400 million sperm are usually present in the several millimeters of each ejaculate. So parang pag i-multiply mo tong 120 million each ml times average na 3.5 ml, approximately 400 million daw. Okay? So dito na papasok yung sinasabi nating sperm count on fertility. Kasi kapag below 20 million, the person is likely to be infertile. So this is the basis ng parang tintignan natin kapag nagpapa-count tayo, nagpapa-sperm count tayo sa pasyente or nag-order tayo ng sperm count. Kasi nga, kapag below 20 million na yun, most likely, infertile na yung lalaki. Kasi sabi din sa book is that even though only a single sperm is necessary to fertilize the ovum, for reasons that are not understood, the ejaculate usually must contain tremendous number of sperm for only one sperm to fertilize the ovum. So, sabi sa book na hindi rin nila alam yung reason kung bakit kailangan na madami. Although, isa nga lang yung kailangan para i-fertilize yung ovum. Ganun. Okay, then effect of sperm morphology and motility on fertility. So occasionally, man has a normal number of sperm but is still infertile. When this situation occurs, sometimes as many as one half of the sperm are found to be abnormally physically, having two heads, abnormally shaped heads, or abnormal tails. At other times, the sperm appear to be structurally normal, but for reasons not understood, they are either entirely non-motile or relatively non-motile. So as you can see on this picture, yung mga itsura ng mga sperm, mga abnormal sperm, kasi yung normal ito yung normal, okay? So kapag may mga pasyente kasi na ganito yung sperm nila, may mga two heads, may mga two tails, may mga abnormal yung head, may abnormal yung structure ng mismong sperm. So kapag mga ganyan yung structure ng sperm kasi, may possibility na infertile yung male. Kasi nga, since they have abnormal infertile sperm, kasi it affects the motility also and the fertility rate ng sperm. Okay, so ito yung mga dapat normal para magkaroon ng increased fertility rate or yun. So dapat yung normal sperm, may normal sperm count yung isang lalaki, may normal sperm morphology, tapos dapat yung sperm motility is normal din. So as you can see, this is a low sperm count, diba, kakunti siya. Then abnormal sperm, bignan mo yung head niya, iba yung structure niya. So compared to this normal, diba? And then also in terms of sperm motility kasi, tingnan nyo to, straight siya, diba? Straight yung pag-swim niya. Itong abnormal na to na sperm is that iba-iba yung direction niya. That's why yung fertility rate ng mga to is decrease or infertile sila. Ganun. Male sexual act. Okay, so itong male sexual act, ito yung magiging part 2 ng major subdivision of the function of our male reproductive system. Okay? So, dapat malaman natin dito yung mga different parasympathetic signals, sympathetic signals that will eventually lead to the erection, ejaculation, ganun. Okay? So, the neuronal stimulus for the performance of the male sexual act. So, as you can see, the most important source of sensory nerve signals for initiating the male sexual act is the glans penis. So, in the next slide kasi, makikita nyo, ito yung glans penis kasi. Okay? So, yan, marami daw sensory nerve endings yan. Okay? So, that is the most important source of the sensory nerve signals para ma-perform yung male sexual act. Okay? So, the glans contains a especially sensitive sensory and organ system that transmits into the central nervous system that special modality of the sensation called sexual sensation. So, yung glans penis natin is responsible for the sexual sensation. Okay? So, the slippery massaging action of intercourse on the glans stimulates the sensory and organs, and the sexual signals in turn pass through the pudendal nerve and then through the sacral plexus into the sacral portion of the spinal cord, and finally up to the cord to the undefined areas of the brain. So sinasabi lang dito na during intercourse daw, yung sensory signals or sexual signals na yun pumupunta sa pudendal nerve, then through the sacral plexus, then to the sacral portion of the spinal cord. Okay? So yun yung sinasabi dyan. And then, tandaan kasi natin na ang male sexual act is merong 4 stages. Okay? So yung first stage is tinatawag na excitement stage. Yung second stage is tinatawag na plateau stage. Yung third stage is tinatawag na orgasm. Plus yung last stage or the fourth stage, that is your resolution stage. Okay? So yung acronym natin dyan is EPOR. E-P-O-R. EPOR. Okay? For excitement, plateau, orgasm, and resolution. Okay? So, i-discuss ko muna yung first stage ng male sexual act natin. So, ang una is excitement. So, ano ba nangyayari dito? There's an increase in the muscle tone or myotonia of certain muscle groups. Nagkakaroon din ng increase in breathing rate, heart rate, and blood pressure. So, also, there is what we call vasocongestion, in which it is characterized by flushed skin, and there is also erection of the man's penis. The scrotal sac thickens and elevates. So as you can see, for the excitement stage, there is full erection, and then also there is partial elevation of the testes. Compared kapag unexcited yung male reproductive systems, that there is, diba, hindi siya erect, tapos hindi elevated yung testes. Okay? So, for the penile erection, the role of parasympathetic nerves. Ang mnemonic kasi dito is that kapag sinabing erection or point, penile erection, or diba pag penile erection parang naka-point yung penis, diba? So, yung role nun is parasympathetic. Nakita nyo, point is to parasympathetic. Pag sinabi naman natin ejaculation, that is shoot compared to shoot kasi yun. Kaya sympathetic ang mnemonic dun. So, point is to parasympathetic, or penile erection is to parasympathetic, ejaculation or shoot is for sympathetic. Okay? So, yun yung mnemonic natin dyan. Okay? So, continue tayo. So, erection is caused by parasympathetic impulses. Okay? So, that pass from the sacral portion of the spinal cord to the pelvic nerves to the penis. Okay? Is believed to release nitric oxide and or vasoactive intestinal peptide in addition to acetylcholine. So, since itong sinabi ko kanina, itong penile erection or point or parasympathetic impulse yung responsible doon. Kasi yan ang nangyayari dito. Para magkaroon kasi ng penile erection, dapat yung, alam mo yung mga bilog-bilog na to, that is what we call vascular spaces kasi sa corpus cavernosum na part ng penis. So, this is a cross-section kasi. So, kinat yung penis. Ito yung itsura. Okay, so makikita mo dyan, may corpus cavernosum, may central artery, may corpus spongiosum in which the urethra is located. So, yung mga space kasi na yan, it is filled with blood. Kapag na-fill yan with blood, that will cause the penile erection. So, ano nga ba yung responsible doon? Ang nangyayari kasi, yung mga parasympathetic impulses, they release mga neurotransmitters na tinatawag na nitric oxide saka vasoactive intestinal peptide. So, anong purpose ng mga neurotransmitters na to? They usually dilate, di ba? They usually dilate the different arteries here. So, nangyayari kapag nag-dilate yung artery, di ba? Pag nag-dilate yung isang blood vessel, mas maraming blood ang nakakapunta dun sa organ na yon. Okay? So, nangyayari kapag nag-dilate yung central artery or mga different arteries dito sa penis is that nako-congest yung penis, kaya nagkakaroon ng erection. So, yun yung nangyayari because of the action of the nitric oxide and vasoactive intestinal peptide, which are all vasodilators. Okay? And then also, lubrication is a parasympathetic function. So, parasympathetic impulses, in addition to promoting erection, causes urethral glands and bulbourethral glands to secrete mucus. So, sabi lang dito, basta pag lubrication na yung part, that is a parasympathetic function. Okay? So, the mucus flows through the urethra during intercourse to aid in the lubrication during coitus. Pero sabi sa book kasi, the majority of the lubrication during coitus is produced by the vagina. Okay? So, unlubricated intercourse kasi causes grating, painful sensations that inhibit rather than excite sexual sensation. So, important kasi itong lubrication na tinatawag natin para yung intercourse is not grating, it's not painful, ganun. So, imagine nyo, kapag walang mucus or walang lubrication during coitus, yung ano natin, sexual sensations is inhibited. Ayan. So, yung second stage is tinatawag na plateau. So, sa plateau kasi, there's increased sexual pleasure with increased stimulation and further increase in muscle tension. Also, the breathing rate continues at an elevated levels, copious perspiration, increased myotonia. Okay? Both males and females continue vasocongestion to the max. Cowper's glands secrete fluid to the tip of the penis which may contain live sperm. Scrotum even higher and testicles bigger. So, ito yung nangyayari sa plateau. Okay? So, the Cowper's gland will secrete na siya. So, nagproduce na siya ng fluid, yung Cowper's gland natin. Or other term is bulbourethral gland. So, nagsisecrete na siya ng fluid along the urethra. Okay? Then, also, sabi nila, the color deepens also. So, mas nagiging vasocongested na yung penis. And also, the prostate enlarges. The Cowper's gland also. And then the testis is fully elevated, and then also there's a marked increase in the size of the testis and the scrotum thickens. Okay? So lahat yan yung mga nangyayari sa plateau stage natin. Then the third stage is orgasm. This is a short test phase of the sexual response cycle, typically lasting only several seconds. So the heart rate and the blood pressure increases maximally. So the contraction of the seminal vesicles, vas and prostate, and there is also contraction of the urethra and penis, leading to ejaculation. So, ito yung shortest phase of the sexual response cycle. So, nangyayari, there is penile contractions. There's also urethral contraction. So, anong purpose ng mga contraction na to? Para ma-push nila yung sperm or yung semen from the inner part of the male reproductive system outside to the external environment or to the vagina or to the female reproductive system. Okay? Then also the contractions force the seminal fluid through the urethra, diba? Then also there is the prostate gland also contracts and the rectal sphincter contracts. Okay? And then also there is seminal vesicle contraction, and then there's also internal sphincter of the bladder closes. So yung importance nun is para hindi magkaroon ng backflow yung semen papuntang bladder. Kaya yung internal sphincter natin of the bladder closes. Okay? So, the emission and ejaculation are functions of the sympathetic nerve. Diba sinabi ko kanina, kapag ejaculation, ito yung shoot, sympathetic. Okay? Shoot, sympathetic. Then, point, parasympathetic. Okay? So, the emission and ejaculation are the culmination of the male sexual act. So, when the sexual stimulus becomes extremely intense, the reflex centers of the spinal cord begin to emit sympathetic impulses that leave the cord T12 to L2 and pass to the genital organs through the hypogastric and pelvic sympathetic nerve plexuses to initiate emission, which is the forerunner of ejaculation. Okay? So, itong emission, from the word itself, emission. Okay? So, lahat na ng mga components ng semen is nabubuo na because of sympathetic stimulation. So, lahat ng prostate, yung prostate gland, yung bulbourethral glands, yung seminal vesicles, they all contract para i-produce yung mga components ng semen. Okay? So, the entire period of emission and ejaculation is called the male orgasm. So, yun yung combination ng emission and ejaculation. Yun yung orgasm na tinatawag. Okay? So, at its termination, the male sexual excitement disappears and almost entirely, within 1 to 2 minutes, the erection ceases, a process called resolution. So, pupunta na tayo dun sa last stage ng male sexual act natin, which is the resolution. Okay? So, sa resolution stage, ito na yung pinaka-last. It begins immediately after the orgasm. It allows the muscle to relax and it allows the body to return to its original non-excited states. And also, during the resolution phase, is that the blood pressure and the heart rate drops. So, babalik na sa normal. Okay, so the erection disappears, the penis is on the unstimulated state, and there is a loss of testicular congestion. And also, the scrotum thins and the testes descends. Okay. Ayan. So, another important point in the male reproductive system is that we must know the hormone known as testosterone. So, testosterone and the other male sex hormones. So, the testes kasi secretes several male sex hormones which are collectively called androgens, including testosterone, dihydrotestosterone, androstenedione. So, testosterone is so much more abundant than the others that one can consider it to be the primary testicular hormone. So, yung general term kasi ng mga male sex hormones natin is tinatawag na androgen. So, yung mga under dito sa androgen is testosterone, dihydrotestosterone, androstenedione. Pero yung pinaka-primary testicular hormone kasi is tinatawag na testosterone. As you can see on the right, this is the chemical structure of testosterone compared to dihydrotestosterone. Okay? Okay, testosterone is formed by the interstitial cells of Leydig, which lie in the interstices between the seminiferous tubules and constitute about 20% of the mass of the adult testes. Okay, so as you can see, ang important point lang dito is that testosterone is produced by the interstitial cells of Leydig. So, saan mo siya makikita? Interstitial. So, it is located on the interstices or on the beside the different seminiferous tubules, diba? So, ito yung seminiferous tubule nyo kasi, itong side na to. Okay? So, makikita mo yung mga Leydig cells dito sa in-between the seminiferous tubules. Okay? Kaya siya tinatawag na interstitial. Okay? And then, also, makikita nyo ito yung mga blood vessel, mga fibroblasts located on the interstitial space ng testes. Okay? Basta, ang important point lang dito is that the testosterone is produced by the interstitial cells of Leydig. Okay, so for the functions of testosterone, in general, testosterone is responsible for distinguishing the characteristics of the masculine body. Okay, so essentially, no testosterone is produced during childhood until the ages of 10 to 13 years old. So during the ages of 10 to 13 years old, dyan na napoproduce yung testosterone, or yung isang male individual, dyan na nagpoproduce ang testosterone during that age. Okay? So, testosterone production then increases rapidly under the stimulus of anterior pituitary gonadotropic hormones at the onset of puberty and lasts throughout most of the remainder of life. So, declining rapidly between the age 50 years to become 20 to 50% of the peak value by age 80 years old. So, sinasabi lang dito na at during the age of 10 to 13 years old kasi tumataas na yung plasma testosterone natin. Okay? So, tumataas na yan. So, at the age of 50, okay, it declines na, bumababa na siya. So, yung plasma testosterone natin, tong red na to, bumababa na siya at the age of 50. It starts to decline, sinasabi niya. Okay? By the age of 80 years old kasi, it is 20 to 50% less na dun sa peak value. Okay? So, ibig sabihin nun, nag-i-start yung testosterone production ng 10 to 13 years old, nagde-decline siya ng 50. Okay? At the age of 80 na, 20 to 50% less na nung peak value. Okay? Yan. Pero kung titignan nyo dito, yung sperm production, nag-i-start din as the testosterone level increases. Okay? Kasi nga, ang testosterone is the primary stimulus for the production of sperm, or it stimulates spermatogenesis. Okay? Ayan. So, note natin yung mga functions ng testosterone. So, yung una, the function of testosterone during the fetal development. So, injection of large quantities of male sex hormones into the pregnant animals causes development of male sexual organs even though the fetus is female. Also, early removal of the testes in the male fetus causes development of female sexual organs. Kasi nga, during the fetal development kasi, kapag na-sense nung fetus na may testosterone, yung yung sexual organ niya magiging male. Pag walang testosterone, magiging female siya. So, yun lang yun. Thus, testosterone secreted first by the genital ridges and later by the fetal testes is responsible for the development of the male body characteristics, including the formation of a penis and a scrotum rather than a formation of clitoris and vagina. Kasi, parang ang default kapag walang testosterone, yung fetus magiging babae. Pero kapag may testosterone na, that is the signal na dapat male yung na-form na sexual organs. Okay? Ayan. So, effect naman ng testosterone to cause the descent of the testes. Diba sinabi na to kanina sa Cryptorchidism? So, the testes usually descend in the scrotum during the last 2 to 3 months of gestation, when the testes begin to secrete reasonable quantities of testosterone. Di ba sinabi ko sa inyo na testosterone is responsible for the descent of the testes. Okay, so administration of gonadotropic hormones, which stimulate the Leydig cells of the newborn child testes to produce testosterone, can also cause the testes to descend. Also, okay. So, di ba, kung i-review natin sa next na presentation, yung effect ng mga gonadotropic hormones natin in stimulating the different cells. Example, Leydig cells para mag-produce ng testosterone. Okay? So, siya yung magiging part 3 natin ng male reproductive system. Okay? So, i-explain ko to more profoundly dun sa part na yun. Okay? Also, the stimulus for the descent of the testes is testosterone. Di ba sinabi ko na ito paulit-ulit na the descent of the testes is stimulated by testosterone, indicating again that testosterone is an important hormone for the male sexual development during the fetal life. Okay. Also, as you can see here, this is the effect of testosterone on the development of the adult primary and secondary sexual characteristics. So, may yung testosterone may effect sa distribution ng body hair, may effect din siya sa male pattern baldness, may effect din sa voice. Yung testosterone also increases the thickness of the skin and can contribute to the development of acne. And then also, testosterone increases protein formation and muscle development. And also, testosterone increases bone matrix and causes calcium retention. Testosterone increases basal metabolic rate, and testosterone increases red blood cells, and it has also effect on electrolyte water balance. So, ito lahat yung mga additional functions ng testosterone natin. So, isa-isayin natin ito. Okay, so the primary sexual characteristics are present at birth and comprise the external and internal genitalia. So the penis and the testes in males, the vagina and the ovaries in females. So pag sinabi natin primary sexual characteristics, these are the characteristics that are present at birth. For example, mga penis, testes sa male, vagina, ovaries sa female. Tapos may tinatawag tayong secondary sexual characteristics. These are those that emerge during the prepubescent through the post-pubescent phases. Example, mga breasts in females and pigmented facial hair in males. So, sinasabi lang sa slide na to, yung difference ng primary sa secondary sexual characteristics. Okay, so ito yung table na showing you that the different changes in male and changes in female in terms of primary or secondary sexual characteristics. As you can see on male, sa primary niya, under primary sexual characteristics, the penis and the testes enlarge, the sperm starts to be produced, secretions released from the prostate gland. Okay? Sa babae naman, ovulation occurs, menstruation begins, the uterus and the vagina grow. So, under the secondary sexual characteristics naman, under sa male, is mayroong growth of chest, pubic, armpit hair, the voice deepens because of the changes in the larynx, and also, sa female naman, the breast develop, growth of pubic and armpit hair, and also there is body changes, the hips widen, and the waist narrows. Okay? Yun lang naman yung mga different characteristics na nakikita, okay, during puberty. Also, in addition, di ba sinabi ko kanina yung effect ng testosterone sa distribution ng body hair. So, as you can see, testosterone causes growth of hair over the pubis, upward along the linea alba of the abdomen, sometimes to the umbilicus and above, on the face, usually on the chest, and less often on the regions of the body, such as the back. It also causes the hair on most other portions of the body to become more prolific. So, sinasabi lang dito na yung testosterone natin, it is responsible for the growth of the hair. So, as you can see, this is the hair distribution on the body. So, pag sa babae, there is usually axillary hair, and there is also pubic hair. Sa lalaki kasi, sabi dito, the hair on most other portions of the body become more prolific. So, mas nagiging abundant yon. So, sa lalaki, tignan nyo, due to the effect of testosterone, there's also axillary hair, there's also pubic hair, okay, there's also appearance of beard and mustache, okay. So, sa lalaki kasi, mas profound yung hair growth natin because of the function of testosterone. Sa babae kasi, may testosterone din sila, pero yung effect is parang, minimal effect or androgen, kasi sabi nila, di ba may sinabi ko kanina, may different androgens tayo. So, yung effect dito sa female kasi is not that prolific as compared as the male. Okay? Kasi ibang androgen yung nandito sa female compared to male individuals. Okay? So yan, as you can see here, 'di ba? Mas prolific talaga sa male. Mas maraming hair na tumutubo sa lalaki. And then also, as you can see, the distribution of the pubic hair because compared to male and female. As you can see, sa male kasi, umaabot yung pubic hair hanggang dito sa part ng below the umbilicus. Yung part ng below the umbilicus kasi na to, tinatawag na linea alba. Okay, so yung growth of hair, umabot hanggang dyan. Sa female, it is located on the mons pubis lang or dito lang na part. Okay. So for male pattern baldness, so testosterone decreases the growth of hair on top of the head. So a man who does not have functional testes does not become bald. So many virile men never become bald because baldness is a result of two factors. So yung una, genetic background for the development of the baldness, and superimposed on the genetic background is also large quantities of androgenic hormone. So sabi nila, related daw yung testosterone sa male pattern baldness. So as you can see na many virile men daw never become bald because baldness is a result of two factors. So dapat meron yung dalawang factors na to that will eventually lead to the appearance of baldness on a male individual. So kung kulang yung isa dito, most likely yung baldness hindi mangyayari. Okay? Kasi sabi nila dito, yung testosterone daw kasi dinidecrease na yung growth of hair on top of the head. Diba sinabi ko kanina sa previous slide na it is responsible for growth of the hair, diba? Sa mga different regions ng male individual. Pero nakita rin nila na testosterone daw, it decreases the growth of hair on top of the head. So para siyang exception dun sa sinasabi nila. Okay? So yan. So usually, yun nga, important yung genetic background, saka kailangan ng sobrang daming androgenic hormones, for example, testosterone, para magkaroon or mag-manifest yung patient with baldness. Okay? Kasi ang baldness kasi is namamana siya or there's a genetic background. Okay? Also effect on the voice. So testosterone causes hypertrophy of the laryngeal mucosa and enlargement of the larynx. So the effect at first causes a relatively discordant cracking voice that gradually changes into a typical adult masculine voice. So nangyayari kasi, kung naalala nyo, di ba may mga sinasabi silang nagbibinata kapag mga pumipiyok na individual. So yan yung sinasabi dito. Ito yung effect ng testosterone. Kasi nga, hindi naman agad-agad na mag-hypertrophize yung larynx or hindi agad-agad na magpo-form ng tinatawag nating masculine voice yung isang individual. Kasi nga, kailangan mag-develop muna. Okay? Okay? Or may stimulate muna ng testosterone para magkaroon ng hypertrophy ng laryngeal mucosa at enlargement of the larynx. So kung sinasabi nila na yung nagbibinata ka dahil yun sa effect ng testosterone natin. Okay? Kasi nga ang ginagawa niya usually yun. 'Di ba? It causes the masculinity or it causes a masculine voice for a male individual. This is a picture of the larynx. Okay? Okay, ayan. So, nangyari dyan daw, nag-hypertrophy daw siya. Okay? Causing the masculine voice. Also, testosterone increases the thickness of the skin and can contribute to the development of acne. So, testosterone increases the thickness of the skin over the entire body and the ruggedness of the subcutaneous tissue. It increases the rate of secretion by some or perhaps all of the body's sebaceous glands. Excessive secretion by the sebaceous glands of the face, which can result into acne. After several years of testosterone secretion, the skin normally adapts to the testosterone in a way that allows it to overcome the acne. Okay? So, anong nangyayari dito? Due to the increased testosterone, it causes thickness of the skin, and also it also increases the rate of secretions ng sebaceous glands dun sa isang male individual. So dahil dun sa excessive secretion na yun, it can lead to acne. Okay? Ayan. Pero sabi nila, after several years naman, nag-a-adapt naman yung katawan dun sa levels ng testosterone. Okay? Kaya nadi-decrease yung acne ng isang individual. And then also, testosterone increases protein formation and muscle development. So, one of the most important male characteristics is the development of increasing musculature after puberty. So yan. So averaging about a 50% increase in muscle mass over that in the female. So as you can see, because of the testosterone or the testosterone effect on the male individual, nagkakaroon ng increased musculature after puberty. So nagig-increase yung muscle mass. Bakit? Kasi many of the changes in the skin are due to the deposition of proteins in the skin, and the changes in the voice also results partly from this protein anabolic function of testosterone. Kasi nga, ang testosterone kasi may tinatawag tayong anabolic, mnemonic, nag-a-add siya. Diba? Anabolic, nag-a-add siya. Okay? So, ibig sabihin, due to its anabolic function, it increases the deposition of proteins, diba? Alam nyo naman na ang proteins is responsible for muscle formation or para maging develop yung muscle, diba? And then also, synthetic androgens are widely used by athletes to improve their muscular performance. So yun, may mga other effects ng testosterone. Okay, testosterone also, or synthetic androgens are also occasionally used in old age as a youth hormone to improve muscle strength and vigor, but with questionable results. So may effect din daw siya sa muscle strength and vigor kapag binigay sa mga old age patient natin. Okay? Pero questionable pa rin yung result. Then next is that the testosterone increases bone matrix and causes calcium retention. So the increase in bone matrix is believed to the result from the general protein anabolic function of testosterone plus the deposition of calcium salt in response to increased protein. So sinabi ko kanina yung anabolic function ng testosterone, di ba? Ang additional function niya is it increases the deposition of calcium salt. So dahil dun sa deposition ng calcium salt na yun, mag-i-increase yung bone matrix. Okay? Because of the ability of the testosterone to increase in the size and strength of bone, it is sometimes used in older men to treat osteoporosis. So because of that effect, or dahil ini-increase yung bone matrix, pwede siyang ibigay sa older men to treat osteoporosis. Okay? So additional lang, yung mga anabolic effects ng testosterone natin, it is responsible for pubertal spurt of growth at puberty. It is responsible for bone growth, which increases the thickness and the length of the bone. Estrogen from testosterone, fuse of bones and mineralization. Okay, so responsible sa fusion ng bones and mineralization, and also for muscle building, if aided by exercise also. And then positive nitrogen, minerals, and water balance increases in weight. Okay, because of that, and also increase in appetite, acceleration of erythropoiesis. So I will discuss more about this sa next slides. Okay. So testosterone increases bone matrix and causes of calcium retention. So ano to? Continuation ng part na yun. Okay, so testosterone has a specific effect on the pelvis to narrow the pelvic outlet, to lengthen it, to cause a funnel-like shape instead of the broad ovoid shape of the female pelvis, greatly increases the strength of the entire pelvis for load bearing. So in the absence of testosterone, the male pelvis develops into a pelvis that is similar to that of a female. So sabi niya, na responsible yung testosterone sa formation ng tinatawag natin na male pelvis. Okay, kasi yung characteristic ng male pelvis natin or tinatawag na android pelvis is that there is longer sacrum and also more narrow subpubic arc compared sa babae. Kasi yung female pelvis kasi is tinatawag na gynecoid pelvis. Okay, it is usually wider and broader, and then there is also less prominent ischial spine. So yun yung characteristic ng female pelvis or gynecoid pelvis as compared to android pelvis. So ang important dito is that kung walang testosterone, pwedeng magkaroon ng female pelvis yung isang male individual. Okay, so kung wala naman siyang, or kung yung level ng testosterone niya is sufficient naman, it can develop syempre android pelvis or the male pelvis. Okay, kasi yung effect niya, it narrows the pelvic outlet, lengthen it, and causes a funnel-like shape. Okay, and also it increases the strength of the entire pelvis for load bearing. So yun yung mga functions ng testosterone dito sa pelvis ng isang lalaki. Okay, so ito yung mga nice to know lang natin. May 4 types kasi tayo ng pelvis. So pag babae, ito yung pinaka-optimal gynecoid. Okay, Okay, then there's also some females na may platypeloid na pelvis in which yun, para siyang oval shape. Okay, kapag android naman, lalaki to. So usually heart shape siya. Okay, kapag meron din yung mga ibang pelvis na tinatawag na anthropoid. Okay, this is parang sinasabi nilang ape-like. Okay, ape-like pelvis. Okay, testosterone increases the bone matrix and causes calcium retention. This is a continuation also. So when the great quantities of testosterone or any other androgen are secreted abnormally in a still growing child, the rate of bone growth increases markedly, causing spurt in the total body height. Okay, sabi nilang dito na kapag may presence ng testosterone, tumatangkad yung bata. However, the testosterone also causes the epiphysis of the long bone to unite with the shafts of the bone at an early age. So, ibig sabihin, mabilis nga yung pag-grow niya, pero mabilis mag-stop. Gets nyo ba? So, mabilis lang yung pag-grow niya, pero yung pinaka-length niya is parang limited na lang. Kasi nga, it causes the epiphysis to unite at an early age. Kasi nga, di ba kung maalala nyo, kapag nag-unite ang epiphysis natin sa long bones, di ba, nag-i-stop na yung pagtangkad ng isang individual. So, ang ginagawa ng testosterone kasi, ini-increase niya rapidly or markedly. So, mabilis tumangkad yung isang individual. Kaso nga lang, yung mabilis na yun is nagiging limited. Kasi nga, it also causes the long bones epiphysis to unite at an early age. So, matangkad lang siya, mabilis lang siya tumangkad, pero yung result is maliit pa rin. Parang ganon. Okay? So, therefore, despite the rapidity of growth, this early uniting of the epiphysis prevents the person from growing as tall as he would have grown. Okay? So, yung sinasabi ko, had testosterone not been secreted at all. So, even in normal men, final adult height is slightly less than that which occurs in male castrated before puberty. So, mga normal men na nagpo-produce ng normal testosterone, yung final adult height nila is slightly less dun sa mga lalaki na natanggalan ng testes before puberty. Okay? Dahil nga sa effect ng testosterone na nag-unite agad yung epiphysis. Kaya yun, parang mabilis na siya tumangkad, pero mabilis nga siyang tumangkad, pero mabilis din mag-stop yung pagtangkad niya. Ganun. Okay? Then next effect ng testosterone, it increases the basal metabolic rate. So injection of the large quantities of testosterone can increase the basal metabolic rate as much as 15%. So this increased rate of metabolism is possibly an indirect result of the effect of testosterone on protein anabolism. With the increased quantity of proteins, the enzymes especially increases the activity of all cells. Okay? So yun, take note mo lang yung effect ng testosterone sa protein anabolism. Basta take note nyo na testosterone is for anabolism. Okay? Dahil doon, nagkakaroon ng increased protein, di ba? Pag na-increase yung protein, magkakaroon din ng increased availability ng enzymes. Kaya nagkakaroon ng increased activity for the cells. Okay? So yan, basal metabolic rate, mga factors affecting basal metabolic rate. Okay, so the greatest factor affecting basal metabolic rate is muscle mass. Diba? As we discussed earlier that yung muscle mass ng lalaki is mas mataas kaysa sa babae. So, increase yung BMR in lean muscular bodies. And also, women generally have lower BMRs than men because nga, decrease yung muscle mass ng female as compared to male. Then testosterone increases red blood cells. So when normal quantities of testosterone are injected into a castrated adult, the number of red blood cells per cubic millimeter of blood increases 15 to 20%. Also, the average man has about 700,000 more red blood cells per cubic millimeter than the average woman. So testosterone does not appear to directly increase the erythropoietin levels or have a direct effect on red blood cell production. So the effect of testosterone to increase the red blood cell production may be at least partly indirect because of the increased metabolic rate that occurs after testosterone administration. So sabi niya, it does not increase the erythropoietin level. Pero dahil sa indirect effect niya sa metabolism or it increases metabolic rate, diba kasi nga ganito yan. Pag increase kasi yung metabolic rate, yung katawan natin kailangan ng mas maraming oxygen, di ba? So, anong ginagawa ng katawan para ma-compensate niya yung increased need for oxygen? Increase yung red blood cells, di ba? So, pag yung katawan natin or yung isang due to the effect of testosterone to increase the basal metabolic rate, yung compensatory mechanism ng katawan is to increase the red blood cell para magkaroon ng homeostasis or equilibrium between the demand and the supply of oxygen in the body. Okay, so parang yung effect ng testosterone is indirectly kasi nga tinataas niya lang yung metabolic rate. Because of that increased metabolic rate, it increases the red blood cells to compensate for the need for increased oxygen or nutrients needed by the body due to the effect of the increased metabolic rate. So, take note nyo lang dito na ang average man has about 700,000 more RBCs per cubic millimeter than the average woman due to the effect of testosterone in increasing the metabolic rate and also increases the red blood cell production indirectly dahil nga dun sa increased metabolic rate na sinasabi ko kanina. And then last effect ng testosterone is the effect on electrolyte and water balance. So many steroid hormones can increase the reabsorption of sodium in the distal tubules of the kidney. So testosterone also has such an effect but only to a minor degree in comparison with the adrenal mineralocorticoids. So nevertheless, after puberty, the blood and the extracellular fluid volumes of the male in relation to body weight increase as much as 5 to 10%. So since ang testosterone kasi is a steroid hormone, so yung effect niya is parang effect na rin ng mga mineralocorticoids natin. Diba alam naman natin or TikTok natin na kapag yung sinasabi nating mineralocorticoids saka yung mga nitong testosterone, diba? They're all cholesterol based, diba? So yun. So yung effect kasi ng mga yun is usually may effect sila sa electrolyte and water balance. So sinasabi lang dito, yung testosterone meron siyang effect pero minor degree lang. Okay? So parang other function ng testosterone. Okay? Na dapat i-take note din natin. Okay? So take note lang din natin because of the effect nun or because of the testosterone effect, the blood and the extracellular fluid volume on the male in relation to body weight increases as much as 5 to 10% because of the minor degree effect of testosterone. So yan. So ito yung nephron natin. Diba? Yan. Thank you.